Das Oberthema dieses Jahr ist Frühwarnung und darum geht es auch in unserem ersten Panel. Das ist wirklich sehr spannend, sehr hochkarätig besetzt. Es wird auf Englisch stattfinden und dafür gehe ich jetzt auch ins Englische. I'm switching to English and I'm saying hi to Siahaan, my colleague who will be hosting this panel today. Hi, Kara.
Thank you so much, Maria and Stefan. Very delighted and honored to be here. Can you hear me well? Just checking. Hello?
Yes, we can hear you.
Okay, excellent.
Yes, perfect.
Thank you everyone, and welcome to the participants of the conference. My name is Siahaan. I am the Early Action and Disaster Risk Financing Coordinator sitting at the Climate and Resilience Unit of the International Federation of the Red Cross and Red Crescent Societies in Geneva. As reflected in the title of this opening panel, we will talk about the opportunities and challenges of multi-hazard early warning systems in the context of COVID-19 and climate change. Early warning systems constitute a prerequisite for effective disaster risk reduction and climate change adaptation. Being prepared and able to react at the right time in the right place can save lives and protect the livelihoods of communities at risk all over the world. Forecast and detection capabilities are becoming more precise. Data science and research have transformed the way we understand risk as organizations. Innovations such as forecast-based financing for anticipatory action are flourishing to help organizations and communities in over 60 countries to take action ahead of disasters. Organizations and governments have policies and operational frameworks in place. We all have the ambition of meeting the Sendai target. Especially for this session, we are looking at Sendai target G to substantially increase the availability and access to multi-hazard early warning systems and disaster risk information and assessments to people by 2030. And of course, sitting here in my living room in Geneva, and I know that we were supposed to initially be present, sitting in the same space together, we are all aware that more than ever before, the importance of anticipating infectious diseases has become particularly evident in the context of the COVID-19 pandemic. So we hope that this panel will really serve the conference as a starting point to spark ideas and inspire discussions throughout the 2 days by providing a broad perspective into understanding the multi-sectoral aspects of early warning systems, through hearing the insights from the World Health Organization and the World Meteorological organizations on where we are today, where are the advances, where are the progresses, where are the challenges, and where exactly are the most urgent needs towards translating early warning into early action, better preparedness, and timely response. Before I introduce our distinguished speakers, I would like to show you the video from the World Meteorological Organization to help us situate ourselves today on the principles of multi-hazard early warning systems. Thank you so much for showing the video. So before I hand over to our speakers, I would like to ask the audience again. This is supposed to be an interactive interactive session. We hope to get your engagement. So there are 3 ways that you can participate and join the discussion. First is to join us by Mentimeter. So I will pull up now the screen where you can participate by answering the question, what is needed to strengthen multi-hazard early warning systems in the context of COVID-19 and climate change? So you can put your input, maximum 2 words per entry. That's one way you can participate. And also behind me, you will see throughout the discussion, the Mentimeter number where you can log in. So again, menti.com and use the code 7448565. The second option for you to also participate is, of course, to put your comments in the question box. And the third way is at the end, when we are in the discussion session, the Q&A, we will be able, if we have time, to call 1 or 2 people to join in person, and you will have the chance to participate and ask your questions face-to-face to our speakers. So I would like then to introduce our distinguished speakers. We have with us today Professor Gerhard Adrian. He is he has joined the Deutsche Wetterdienst, the German weather service, since 1999 and was appointed in 2002 as adjunct professor of meteorology at the University of Karlsruhe, Germany. Since 2010, he has been the president of Deutsche Wetterdienst and was elected as the president of the World Meteorological Organization, WMO, last year. We have also Dr. Michael Ryan, the executive director of the World Health Organization, WHO. He has been at the forefront of managing acute risk to global health for the last 25 years. And I can imagine if you have been watching the news for the past 6-7 months, you would have seen Dr. Ryan already. He has worked in conflict-affected countries and led many responses to high-impact epidemics, also a founding member of the Global Outbreak Alert and Response Network. We have with us also Dr. Boris Pavlin, the acting unit head at the Field Epidemiology Services of WHO's Health Emergencies program. So welcome, gentlemen, to the session. So I will now hand over to Dr. Adrian for his presentation to set the scene for us.
Yeah, thank you very much, and I hope you could hear me. I try to share my screen with you. I hope it works. Okay, I see nodding. Thank you very much. Yeah, role and contribution of WMO to multi-hazard early warning systems. This presentation was prepared also, or I received a lot of support by my colleagues from the WMO Secretariat, by Cyril Honoré, as well as Jochen Luther, both from the Secretariat of the WMO. Yeah, WMO, looking to the convention of WMO, which was formulated about 70 years ago, I copied here 2 parts from this, which identifies why I'm sitting here. There's written the importance of an integrated international system for the observation, collection, processing, and dissemination of meteorological and hydrological and related data and products. Behind products, you find there's hidden services. That means also including warning systems. It was also formulated reaffirming the vital importance of the mission of national meteorological and hydrological services in observation, understanding weather and climate, in providing meteorological, hydrological, and related services in support of relevant national needs, which should include the following areas: protection of life and property. I think that's our theme, our most important task of the World Meteorological Organization. Of course, as an UN organization with a secretariat of about 300 members of staff, it is impossible to solve this problem on the global scale. So the real work is done on the local level, that means on the national level, and the interface between the global scale, the global system and the local system are the national meteorological and hydrological services. This was formulated, this objective or this task to WMO and to the National Meteorological and Hydrological Service, protection of life and property. This was formulated about 70 years ago. Yeah, only a few words about the World Meteorological Organization. It's not far away from the location of the International Red Cross Organization, the headquarters there. It's a specialized agency of the UN with 193 member states and territories. It provides a framework for essential international cooperation. As I said, it cannot do everything. It cannot do the real work at the end, but it encourages research and training, fosters rapid exchange of meteorological and hydrological information. That's very important for us. This requires a standardization of data, builds cooperation between National Meteorological and Hydrological Service with their stakeholders. And here in this meeting, the most important stakeholders of the national meteorological organizations, or from my perspective, also as director of the German National Meteorological Service, the Deutscher Wetterdienst, are here in this meeting. Yeah, and of course facilitates the design and delivery of high quality authoritative weather, climate, hydrologic and related environmental services. And that's especially, there's we find more, but one objective, of course, is the support of developing early warning systems. Why meteorology and hydrology is critical here? You see here three perspectives of most of the vast majority of disasters, and they are triggered by hydrometeorological hazards. That's a number of recorded deaths. Yes, it's an earthquake. That's nothing to do with meteorology. But you see here storm, flooding, including inundation, heat, droughts, landslides, and so on, forest fire, wildfires. And this, you find this same picture also if you look to the economic losses here, that the highest economic losses are connected with hydrometeorological hazards, and the numbers of disasters per type again, you see here a similar picture. So that explains the role and the important tasks of the WMO here. Early warning system. Of course, early means to issue a warning before such a hazard occurs. Warning, yes, the WMO request member states really to establish authoritative warning, authoritative voice for warnings. And of course, what we are speaking here about is a system of systems. So I will come back to this in the next slides. We have to bring together observation, monitoring, forecasting, communication, emergency management, and so on. And of course, we as National Meteorological Services, as well as the WMO, are responsible only for one part. So we have to work together. Looking to the weather events, that's I think that's also very important to understand here. That I'm a meteorologist, I have to, therefore I always want to raise that the atmosphere and the atmosphere is a chaotic system. That means that the predictability is limited. And therefore we have very different scales. We are looking to very different scales where very different phenomena occur. Minutes, hours, days, week. That's typically the classical weather forecast. However, for instance, looking here in Germany, let's say our most critical weather events are the severe thunderstorms. We have also up to 25 tornadoes per year in Germany. And they have a predictability of a deterministic predictability of about 30 minutes or even less. That means an early warning system means it's every weather information beyond 30 minutes forecast range is for these scales an early warning from our perspective. Of course, there are these severe winter storms here in Germany. Only for this, as an example, there we are here between several days to up to 1 week. So weather forecast beyond 1 week is an early warning from our perspective. Here we have the situation of droughts, for instance, as we have also in Europe and many other regions worldwide, also connected. We heard about the wildfires in Australia, for instance, this year. And here we have the climate change. And for these, we are developing, our community is developing specialized meteorological and hydrological forecast systems. But we have to understand that the forecasts, the information coming from these systems are today probabilistic forecasts. So we try to forecast, not only give you the information they may happen with this something, but we connect this always with the likelihood that something happens. Likelihood means that if you have a likelihood of 80% of a severe thunderstorm in the region, for instance, where we are here in this region, that means also that that the likelihood is 20% that nothing happens, and that has to be understood, and that makes it very difficult really to work in early warning systems. But we are not. That's what one of our challenges. We have here in the again a European example, this Meteor Alarm system with the collaboration of the European Meteorological Services, where we try to bring all the weather information, the weather warning on one platform together. And this system was more or less the prototype for a global system, which is coordinated by the WMO. Of course, we have to recognize, for instance, I spoke about Germany because I come from Germany. Severe thunderstorms, the winter storm, and the winter storms are the most challenged. We don't have tropical cyclones, for instance, here. That means that every warning system depends on the local meteorological warning system, and hydrological system depends on the local climate. We have to recognize this also. Going now to the next slide, how does WMO work? Of course, at the beginning, it's observation and monitoring. The atmosphere is a global system we need for every kind of weather forecasting, always a global information. And that's what WMO is coordinating. Here you see all the observation platforms we are managing. And this is also the quality monitoring system, which is also organized by WMO. You can recognize there are many areas we do not have very much observations. These color-coded, there's a quality of observations. So we have a challenge here also to keep this this infrastructure running. COVID-19. Here you see the number of aircraft reports, weather reports from commercial aircrafts, and they are dropping down because of the COVID-19 crisis. The number of aircrafts in the air was strongly decreasing. That's the global view. That's a global view. Looking to Europe, I can tell you that we had during the summer season only 5% of the aircraft observation than we have at usual times. And this might have an impact, which we cannot impact on the quality of weather forecasts, but which we are not able to quantify directly. Because we don't have we cannot compare the forecast with the whole observing system against a situation with limited observations, because at least not for this period. This was done experimentally by the European Center for Medium Range Weather Forecasts for a period in the past, and we lost about half a day of predictability, which is not very important for the short range, but for the medium range weather forecast going up to 2 weeks, that might become critical. Organized by the WMO as well. You see here in the lower part of the picture this in some areas WMO coordinates that to for instance in Europe, we were able to organize additional observations by classical radio soundings to replace or to compensate the loss of observations. But there are also in large areas, you see this red triangles where we have a decrease of observations because the human observers were not able to fulfill their tasks. So we are also, the meteorology is connected, is influenced directly. The operational meteorology is directly influenced also by such a pandemic. Yeah, the next step after observation is modeling and simulation, forecasting, prediction, projection. We have a global information system where we have in near real time all weather observations are distributed over the world. So we need, for instance, in Offenbach in Germany, all the observations coming from the Pacific Oceans in near real time to provide our tasks, and vice versa. That's organized by the WMO. What we have also, we have a system of global and regional data processing systems. That means, for instance, that's the name of the program. We have special designated centers for long-range weather forecasts, for global forecasts, and also specialized centers, in regional specialized centers, providing all the necessary information to establish a global early warning system, especially from the meteorological part of, from the meteorological point of view. And here you see a prototype, the global multi-hazard alert system of WMO, which is distributed in the UN system. Also, there are a lot of questions behind, not from the meteorological part, but how this information is used, the communication of the information. There we have spent a lot of work together with our partner organizations in the UN system, but also with the NGOs, really to understand, to enable people to really understand weather information. I learned recently that, for instance, in the Arctic regions, the people living there, they have in their local languages, they classify snow into 20 different kinds of snow, and they want to get this information. I'm not able to distinguish because it's not relevant for the region where I am sitting. So for me, it was a very critical example where we have to learn also how to communicate our information and how to enable the users and the professional users, that means also those working in the disaster management, to make an optimum use for this information. I can tell you that we are working also together with social scientists to how to communicate. We have a project, we now as a German Weather Service, a project, for instance, also with the DKKV, together with the University of Berlin, to work together with the Fire Brigade of Berlin as a prototype, what kind of information a professional user needs and how to, and to explain them what they can do with this information, how to use it. Okay, that's my summary. I think I spent too much time. Sorry for that. And so I stop here. Thank you very much.
Thank you so much, Dr. Adrian. It's really elaborate and robust what you're explaining to us, and we really look forward to unpacking what that means in the discussion session. And I will hand over now to Dr. Ryan from the World Health Organization. Dr. Ryan, over to you.
Great, thank you. And I'll be followed by Boris directly. Certainly COVID-19 and climate change have collided, but infectious diseases have been colliding with environmental and social change for millennia. Our biome is complex and it's highly sensitive to small changes in our climate, in our environment, in our social and in economic behaviour. The risks are currently converging, but unfortunately our responses are not yet coherent enough to make a difference. On the WHO side, first of all, I'd like to thank all of our German colleagues out there in the Red Cross and the German government and the ministries. Germany has been one of the strongest supporters to WHO historically, and certainly through COVID, and has donated over $355 million to our efforts across a whole range of response activities, research and development, and to the ACT Accelerator. And in particular, a shout out to Professor Lothar Wieler from RKI, who's chairing our current review of the IHR, and a really important instrument in long-term management of infectious diseases, and to our colleagues at Charité Hospital and the German manufacturer who made the first PCR tests that were distributed all over the world in record time. And it maybe speaks to what you said at the very beginning in your introduction. Early warning must lead to early action, and I think that's where we're finding difficulty, is connecting early warning to early action, whether that's at community level, national level, or at global level. And I think that's our bigger challenges. Technologically, we have challenges, but in my view, connecting science to governance, connecting science to decision-making and action has probably been the greatest exposed weakness of this response globally to COVID-19. We're not just seeing a revealing of a lack of technology or a lack of data, but a lack of action in response to that data. And I think that's something else we should be looking at as we move forward. Inside WHO, our program is 4 years old, 5 years old now, was really created out of the experiences in West Africa and many other emergencies. Thankfully, in WHO, we have a fully integrated emergency response framework, an incident management system that is multi-hazard from the get-go, both and at the 3 levels of our organizations, at the 6 regional offices, at the sub-regional level, and with our partners in the WHO collaborating centre networks and the Global Outbreak Alert and Response Network, and amongst the emergency medical team movement. The Sendai framework has been fully integrated into our global programme of work for the next 5 years in WHO, and the Sendai framework and the IHR have been linked together so that the framework for Sendai as a broad-based multi-hazard disaster risk reduction instrument to the IHR, which is primarily an infectious disease instrument. And we're also working very closely with OIE and FAO on the animal hazard parts of that. Also, I think of note is in the last year we have specifically created a preparedness division within the emergencies programme. As we're drawn more and more into response, we felt we needed, half our programme to be fully dedicated to the preparedness agenda, so that we don't continually respond, and not actually invest in preparedness. Finally. Boris will outline some of the systems we've been developing over the last number of years and into the future. And clearly, there's a huge opportunity now, globally, as we are more connected. And I think maybe our connectedness has been our downfall in this response. Infectious diseases move along our pathways of human connectedness, and our technologies and globalization have driven the spread of that disease. But I believe we can turn what is on the face of it a weakness into a huge strength, because it is that very connectedness that allows us to bring data and minds together in order to define solutions, to create early warning, to give us time to act, to predict epidemics, to detect them early, and also to recognize the growing intertwined nature of climate change and infectious diseases. These are extremely intertwined, and the planet has choices to make about climate change, about climate justice, about infectious diseases, about health systems justice or healthcare access, as issues not only of scientific interest, but ones of core social justice on this planet. So I'll hand over to Boris, who'll give you a quick update on some of our systems. Boris.
Great, thank you. I'm going to share my screen. I hope you can see that. I'll be talking about public health early warning systems from a WHO perspective. As you may be aware, an epidemic typically follows a predictable course of initial cases, a rise in cases, and a peak followed by eventually a decline in cases. But our response, the speed of which we do it, dictates how many cases occur. And if we only take a response after the event has nearly run its course, we don't have much opportunity for control. So if we can push all that forward, we can avoid the vast majority of cases that would occur. In WHO and in general for detecting public health events of all hazards, we follow 2 major data streams. One is indicator-based surveillance, which is your sort of typical counts of cases of outbreak-prone nature. The other is event-based surveillance, unstructured information such as an unusual die-off of animals or people with a similar illness in a certain place. We collect these signals of these events happening. They go then through a verification process and a risk assessment that determines whether a response is needed. We have a system called the Epidemic Intelligence over Open Sources platform, which aggregates enormous numbers of reports from formal and informal sources and helps us sift through all that information to figure out what's really of public health importance at any given time. And out of the 500,000 or so pieces of information that may be detected annually, typically we would do we would process 5,000 signals and investigate 300 events and conduct 10 risk assessments. We then share information and ask requests for information via a closed system called the Event Information Site, which is for IHR, International Health Regulations, national focal points, and other key partners, where we either look for information from them or they report on events that they think are of public health concern. And this is then shared throughout the network. We do have a number of key challenges. One of these is receiving alerts on time and getting better use of event-based surveillance such that we need to lower the threshold for people to report things to us or to the global community, and also to tap into systems that are and build upon systems at the national levels that would allow harnessing of event-based surveillance and allow the lowest level information to be quickly processed up to the national and global levels, because every event starts small in our world. The second issue is that of sharing detailed case-based data. There's still a global reluctance to share details about what's happening, particularly before things are verified. And so after an initial alert, countries often don't provide sufficient detail for us to properly assess the risk, or for even their own national governments to properly assess the risk, because the details are needed to characterize the event. And the third point is to tap better into the use of indicator-based surveillance at the global level. We're not able to get case reports, the numbers of cases of diseases happening worldwide at any given time. It's a long process before those numbers get to us. And so we can't tap into that for early warning. We do have systems within WHO for event-based and indicator-based surveillance that we can roll out and collect those data and have them available at our fingertips in real time. But this example, eWars in a Box, is deployed in a limited number of places, particularly in places that are conflict affected or after a disaster, a natural disaster. And so we do get data from there, but the reach is significantly limited. WHO has thus undertaken a strategy, a global surveillance and early warning strategy that seeks to harmonize surveillance activities across ourselves, first of all, and then to support member states to detect events more rapidly and be able to share on a platform that everyone can work on. This is just an example, obviously not to dwell on it, of the different types of activity, of the different types of systems in different countries in Africa alone. And so we are looking right now on a data sharing platform that could help us harmonize these. Finally, I want to mention how we have a vision called a project called EpiBrain that seeks to harness these and all other possible data sources through a big data analytic methodology to generate real-time prediction to enable preparedness and readiness for the coming epidemiologic storm. Thank you.
Thank you. Thank you for the speakers, and thank you for the two great presentations that give us really an overview of the role of WHO and WMO in multi-hazard early warning system. And it's very encouraging also for me to hear that whether it's health or hydrometeorological, the issues are similar, and also the focus that we want to drive forward is also similar. It's about making sure that early warning leads to early action, making sure that decision-making are taken at the national and local levels. So I just want to remind again the audience, I've seen that there are many input already to the Mentimeter. I've seen a nice word cloud developing based on your input, but we haven't seen any questions on the chat box. So feel free to enter your questions in the chat box. And again, you have the click there on the bottom of the screen that also gives you an opportunity to come to a face-to-face Q&A at the end of the session. So maybe for now, I would like to ask Dr. Adrian on your input on from WMO. We have seen for sure the, let's say, wealth and breadth of what WMO does. And I would like to pick on your point about the importance of the National Hydromet Service's role in all of this and translating what they do into local action. And we are here with mostly experts and practitioners working on disaster risk reduction. Then perhaps I would like to ask you, in terms of the challenges, you've mentioned some, but in terms of the challenge WMO face, what is the weakest link of translating that early warning into early action from all the challenges you mentioned? And if you were to speak to the conference participants today about what they need to be talking about, what they need to bring into the discussions over the next 2 days, what would those be?
I think the critical issue at the end is on all scales is the issue of cooperation, to organize the cooperation between the different sectors. We, at the beginning, in the German part of the introduction to this meeting, we heard about the interdisciplinarity which we are faced with, and we have to work together. And I'm very happy that the WMO Congress has decided to open its governance system to partner organizations. So partner organizations are invited really to contribute to the further development of the WMO systems to support their activities. I think that's very important. We have to work on this on all levels. That is on the global level, of course, that's done by the WMO, but we have to do this also on the local level. That means on the national levels.
Great, excellent. And now going to the presentation of WHO. We also have seen the robust, let's say, system that you have in terms of detecting, surveilling, and strengthening the early warning system related to public health. The same question to you. We have, let's say, a wide range of expertise in the room and also in the participation of the conference. What do you think is the weakest link? You've spoken broadly about what the challenges are, but if you can provide a message to our participants today about where should disaster risk reduction experts and practitioners be looking into and calling upon in terms of the strengthening the interdisciplinary collaboration between health and hydrometeorological sectors. Over to you, Dr. Ryan.
Great, thanks. No, I think it really is at the it's at these interfaces we really have to improve. The animal-human interface, the environment-animal-human interface, and the environment-human interface, because these data that are in the environment and meteorologic sector are critical in predicting events that may affect humans. Yes, the winds may come and your house may fall down, or the floods may come, but as we saw in Mozambique, the floods came in March 2019. We were able to put the EWAR system that Boris mentioned into the field in days and pick up the first signals of a cholera outbreak, for which we worked with our partners in the Global Response Network to carry out a massive preemptive cholera vaccination campaign. And we probably averted a massive outbreak of cholera in that situation. So I think linking these systems together, same with Rift Valley fever in the Horn of Africa. We know from vegetative indexes and we know from rainfall patterns that we can predict Rift Valley fever and other hemorrhagic fever outbreaks in advance. And WMO have done some fantastic work in looking at how do various indexes, which are mainly used for agriculture, can be used in predicting the likelihood of epidemics. And again, we're back to this issue of predicting the likely emergence of an epidemic that can trigger preparedness at community level. And I would say, finally, our biggest challenge, I think, around the world, and we've seen this, is doing this at community level. We have got to be able to empower communities with that knowledge to take action. We know in many disasters like earthquakes and other things that, you know, most people that are saved in a disaster are saved by their local community. And I think it's the same in infectious diseases. We need to empower local communities to take early action to prevent infectious diseases, detect them and respond. But we need governments who are able to support that process, and governments that don't confuse and send mixed messages and don't invest. And I would say, finally, our biggest gap, and I don't know how WMO and others see this, the reality is, given the nature and scale of the impact of these infectious diseases, as we've seen now, it is very, very clear that we have grossly underinvested. We spend trillions of dollars protecting borders from invading armies and terrorists and everything else. We spend almost nothing in percentage terms in comparison in protecting ourselves from biologic or meteorologic threats in that sense. And many times our communities are left to face those disasters on their own, because we are not leveraging the power of data to predict, and we're not leveraging the power of preparedness to prevent and mitigate the impact of those disasters. And I think that is the same for us across all of the different disciplines that are represented here today. Everybody is committed to that, but it's going to take a real, a seismic shift in the investment and the seriousness with which we take this. And that's why I think the Sendai framework is absolutely crucial now moving forward, to be a kind of a rallying call, a central piece of policy and advocacy for us to change that narrative, both for all kinds of disasters.
Great, thank you, Dr. Ryan. We would like to again come back to Dr. Adrian from WMO. So we have seen a lot of great collaboration in forecast-based early action. So humanitarian organizations from the UN, from the Red Cross, Red Crescent network, and also from the NGOs are working to develop forecast-based early action, as I mentioned earlier, in more than 60 countries altogether, looking at different hazards, droughts, floods, cyclones, typhoons. Where do we see the learnings from this experience, Dr. Adrian? What can we bring? Impact-based forecasting is, of course, initially the domain of the work of the World Meteorological Organization, or Met offices in general, but it's now being transformed or being used also in a co-production process, design process between humanitarian organizations and also the National Hydromet offices, as we have seen in many of these countries. So are there any lessons that we could draw upon from this experience, Dr. Adrian?
I mean, we heard before, as we heard before, I mean, yes, impact-based weather warning, that's a discussion in WMO, and the whole community is working on impact-based weather warning. Mm-hmm. However, I'm not sure that this is the right way that the WMO is doing this alone. I mean, as we heard before, the case of Mozambique floods, yes, from a meteorological point of view, this flooding event, which was a large-scale event, this was forecasted quite well by the medium and long-range weather forecast systems on the one hand side, but the effect on the communities, on the cholera pandemic or epidemic afterwards, that was of course not predicted by the National Meteorological Services, because they don't have any competence for that. So that's what we have to improve. We need this network, and to bring together the knowledge the different disciplines have really for this impact-based forecasting to support the disaster management organizations. We have to work together. I think that we have much more than we have done in the past. The WMO and the WHO are partners in this field, and they're working together, and that was also discussed in the last Executive Council of WMO.
Great, excellent. And this is maybe a question for both of you. So we have seen just in this year alone, since the beginning of the pandemic, we have seen flooding, monsoon flooding in South Asia. We have seen Cyclone Amphan. We have seen the flood in Sudan, massive destruction happening, and also losses experienced by communities in these places. So we've heard in so many different channels that the pandemic will not finish very soon. We have heard that we have to be ready, and we have to manage this new normal until the end of next year. And I mean, you have more to say on this, Dr. Ryan, but in terms of anticipating what's coming concretely in the next 6 months, 1 year, has there been any discussions between WHO and WMO and other partners on how, again, building on what you mentioned, better coordination, stronger also sharing of risk information, the network, the platforms? What are the efforts being taken today in order to help us prepare for the more immediate, let's say, disasters or crises that we can facilitate?
I think we are facing this increased frequency. Climate variability and change is driving that, but we're also seeing the other vulnerabilities, because it's not just about the weather changing. It's about where the weather is changing and who it's changing for. And if we're talking about urbanization and the proportion of people on this planet who now live in peri-urban, unsupported slums or areas with no running water, and we're creating vulnerabilities, we're creating tinder to burn in terms of epidemics. So if we look at the impact of dengue epidemics in South Asia, or the impact of yellow fever epidemics, or other climate-sensitive epidemics, essentially vector-borne diseases that exploit shifts and change in temperature, humidity, and climate, we're really seeing that there's a tremendous amount that we need to do beyond just the prediction part. There is this vulnerability reduction that we need to do. And therefore, you have this short-term need to do early warning for the event that's coming next week or today. And that's important that we work with WMO on that. But it's also important that we look at long-term patterns and changes in temperature, humidity. We're seeing malaria changing the altitude at which it can transmit. We're seeing lots and lots of different things happening, long-term trends in climate that are driving long-term trends in infectious diseases, and they're interfacing with long-term social and economic changes. And this interaction, this convergence of risk is complex. So we can't just look at climate and infectious diseases. We have to look at the whole thing in the short and in the long term, and that's going to take building platforms together. We've said it before here with the EpiBrain project. We want to build what is effectively like CERN. The biggest barrier for researchers getting into the system is data and the price of data, access to data and data protection. We've always tried to bring data to us to analyze. Now we can go and look at the data in situ with APIs. In fact, in WHO, our event management system doesn't pull any data in. It goes and finds and looks at the data in our whole system and then produces the necessary interfaces for us to see what's happening in country X or country Y. So we have to shift our paradigm of what we mean by data collaboration to use the industrial revolution, or the fourth industrial, the data revolution we have at our disposal right now. And I believe we can do that, both for long-term and short-term prediction around but also modeling what will actually reduce that vulnerability. There's no point having a system, the sky's going to fall in system. We need a system that can also model interventions. What will happen if we provide better vulnerability reduction in geographic area X and Y? Where's the best place to do vaccination programs? Where are the most critical areas to provide safe water initiatives? So we have to use the systems to predict early action and tell us where the best bang for our buck is. If the greatest risk in the Horn of Africa is vector-borne diseases, then we need to focus on that. If the greatest risk in South Asia is diarrheal disease, we need to increase our capacity to deal with that. So that's sort of a dynamic system, and we believe the EpiBrain initiative, and we work with WMO, we're working with the World Economic Forum, we're working with private and public sector on that, is to create a space, a virtual space, in which researchers from all around the world can pool data and knowledge, and we can reduce the barriers to access. Because many scientists in developing countries have a huge barrier to accessing data and accessing platforms and supercomputing to do this. This is a very privileged club right now. The number of people, researchers in the world who truly have access to this system as such globally is very little. And therefore, we need to reduce those barriers to create the collaborative space in which people can safely use data at low cost in order to look for solutions at national and subnational level as well. So there's an awful lot to do, and I think we'll get there.
Thank you, Dr. Ryan. Dr. Adrian, would you like to add to that?
No, I think there's no need to add. That's exactly the problem we are faced with, to bring information together. I mean, the pure meteorological information, climatological information, also what may happen in the future, climate change and so on. That's the information itself. Here, WMO did a lot of work that this information is available, let's say, to every citizen on this globe, or should be available to every citizen on the world. But what does this mean? How to use this information? That's a critical point, to bring information from different sectors together so that the decision makers can really take the necessary decision which is needed in the moment or in the future. Also, this includes also the long-term perspective, climate change. Yes, we have this in the WMO, these long-range forecasting systems. We have the climate prediction centers. We have the regional climate outlook forum. Regional means really for the 6 regions WMO is organized in, to provide all governments with the information which is expected to happen in climate change during in the next years. This is organized on the meteorological, climatological side. But how to bring this information together on the local, on the regional, and on the global level, I think that's what there's still a lot of work to do, besides all the specific problems every discipline has.
Thank you so much for your insights in answering all my questions. In terms of the questions, we have not received anything from the audience, but we actually have already the Mentimeter word cloud that I will show to you now to see when we asked participants about what is needed to strengthen multi-hazard early warning systems. So I will pull that out now in 1 second. Share my screen. Can you already see? I guess not yet. Okay. Okay, now I'm sharing my screen. Can you see what's being inputted by the participants? So again, on the edges, we look at what we have heard actually from all of our speakers today: reaching everybody, exchange of data, infrastructure, data science, digitalization, knowledge, response information, risk management, preparedness, better community engagement, understanding risk, data ethics. Really, it's music to the ears to actually see all of this words actually being shared by the participants. But also, it's also encouraging that they are also prioritizing on coordination, collaboration, and cooperation. So these are really the 3 main themes that participants in this conference are saying that is of highest priority to strengthen multi-hazard early warning systems in the context of COVID and climate change. So I will stop sharing my screen again and come back to the discussion we have. So again, just recapping, we have about 7 minutes left in this session, and I would just like to recap what has been said here today. And again, thank you for our 3 speakers for sharing the amazing knowledge and also the leadership in providing us with better response to both health crisis and disasters caused by hydrometeorological hazards. So we've heard, I mean, I'm really with Dr. Ryan when he says that, yes, we are talking about early warning system today. We are talking about how to translate that to early action, but we cannot isolate the discussion into how we look at the risk, short-term and long-term. This is not a standalone a theme that we should be working on. And that's why also we are here in the German conference for disaster risk reduction. So again, looking into making sure that investment really gets poured into where it's needed, where it's most urgent. We've heard examples of that today. And again, I like the comment on we are connected. That is why the pandemic is an issue. The connectedness was an issue, but we want to use that connectedness to actually strengthen the cooperation, strengthen the collaboration. So how can we work together to reduce the barriers together and look for those solutions? So again, we heard about investing in the relevant capacity, seeing explicitly how both hydrometeorological forecasting and disease modeling are essential in making sure that countries has capacities in communicating the strategies that will help to interpret risk and help the decision making that are fit for context. In early warning system, we need to make sure that our decision is really geared towards understanding or deciding based on what the impact might be. And early warning and risk information also must be provided in the right language. And I don't just mean English or Indonesian or German, but it needs to be understood. It needs to be accepted. We need to be able to understand, communities need to be able to understand what the risks are and why they need to engage and prioritize. And in terms of resources, again, coming back to the issue on investment, early warning as it is will just produce information. And unless we link early warning to actual plans, resources, funding, the infrastructures, it will not translate into early action. So we are here also in this conference. We have also parallel sessions, and there will be a session on anticipatory action that is linked to the last point here, where we hope again to continue the discussion and hearing more from what inspires us in the session and throughout the conference. And before I hand over to our speakers to give the last 1 minute, let's say, insights to wrap up the session, I would just like to show you this nice cartoon that we keep on showing our colleagues, partners, when we talk about this issue of let's say, disasters collaborating with each other and risk being more complex and dynamic and systemic. So here is that picture. Here we are, just to wrap up with a little bit of humor. Sharing my screen now. Okay. Just to reflect with the participants of the conference, you can see here what the cartoonists have shown, have drawn for us. It is unfortunately very true that we are all faced now by the pandemic climate, and we haven't talked so much about, but of course there are conflicts happening all over the world today. So the disasters are collaborating better than we are. We need to work better and stronger in the way that we address this dynamic and systemic risk. So by that, I will hand over to our speakers to give their last 1 minute, let's say, inspirational insights to all the participants. Over to you, Dr. Ryan.
Hi, thank you. Yeah, no, I like that last slide. Of note, 70% of the high-impact epidemics that we respond to are in 30 fragile, conflict-affected and vulnerable countries. So we know that terrible confluence of climate conflict and epidemics. It's happening every day. It's been happening for years, and it really is the central point. Boris and his team work in the engine room of this every single day, tracking the world, finding the epidemics and driving response action, and also, as you've seen, innovating across that with inside and outside the organization. So I will give the last word to someone who works actually in the front line of this. So Boris, your thoughts?
Thank you. I would also add that about 70% of the outbreaks that we face are of animal-borne nature, and that we need to take better care of our planet, our ecosystems, and our climate in order to reduce the risk rather than just preparing for it. But I also look forward to the innovative ways that we can collaborate across different sectors that are involved in this tangled web of human suffering, and do our best to make a difference for people in need around the world. Thank you.
And Dr. Adrian, the last word is yours.
Yeah, thank you very much. I mean, this cartoon describes very well the situation where we are, and as this was discussed by Dr. Ryan as well as Dr. Pavlin. Yeah, from my perspective, really, I mean, we have in 193 member states of WMO and National Meteorological Service, they have all access to the information which is globally available on meteorology. I can only invite everyone who is involved in disaster risk management as well as in disaster risk reduction. Please use the information which is available on the meteorological, climatological, hydrological sectors. Please use the information and go to the WMO, to the regional structures of WMO as well as on the local level. That's an invitation I can speak here. I think that's very important, which should be improved.
Thank you so much. And with that, I thank you to our speakers and again for the participants for joining this session and help us strengthen together multi-hazard early warning system, and especially when climate change and COVID-19 collide in this moment. So thank you, and handing over the session back to our conference host, Stefan and Marie. Thank you so much, everyone.
Ja, vielen, vielen Dank, Cara. Das war auf jeden Fall ein sehr, sehr spannendes Eröffnungspanel. Ich hoffe, euch hat es auch gefallen. Ich habe gehört, ihr habt den Face-to-Face-Button noch nicht so richtig benutzt. Möchte ich euch noch mal ganz kurz daran erinnern. Ihr könnt immer unter dem Hauptvideostream auf den Button klicken und dann live auch Fragen stellen. Kriegt noch so eine kleine Meldung, weil alle unsere Hauptveranstaltungen aufgezeichnet werden, damit wir uns die später auch noch mal angucken können. Erschreckt euch also nicht, aber traut euch ruhig, den Button zu benutzen. Dann habe ich noch einen kleinen Hinweis für euch, bevor es hier weitergeht. Und zwar haben wir ja heute Abend um 18 Uhr einen Mapathon für euch. In vielen Ländern, in denen das DRK tätig ist, ist ja leider keine wirklich gute kartografische Erschließung. Und aus diesem Grund wurde 2014 das Missing Maps Projekt ins Leben gerufen. Ziel dieses Projektes ist es, genau diese schlecht erschlossenen Gebiete eben mit der Open-Source-Plattform OpenStreetMap zu erfassen. Und darüber könnt ihr heute Abend mehr lernen in diesem Mapathon. Wenn ihr in unserem Programm runterscrollt bis 18 Uhr, dann findet ihr den Mapathon da. Klickt einfach rauf und meldet euch an. Ihr seid alle herzlich eingeladen. Ihr braucht auch keine Vorkenntnisse. Lernt ihr dann alles heute Abend. So, und jetzt ist, glaube ich, ein guter Zeitpunkt, dass wir einmal rübergehen hier zu dem Sebastian. Der hat ja nämlich schon das Eröffnungspanel auch mit dem Graphic Recording begleitet. Sebastian, vielleicht kannst du uns noch mal ganz kurz so ein bisschen erklären, wie geht überhaupt Graphic Recording und was hast du da jetzt gemacht?
Ja, Graphic Recording geht folgendermaßen. Ich höre hier immer live zu, was die Sprecher reden. Ich weiß auch nicht, worüber sie reden. Also außer diese kleine Einführung, die da im Programm steht. Mehr weiß ich auch nicht. Und ich arbeite eigentlich quasi wie ein Simultanübersetzer. Also ich muss aber das Gesprochene oder die Kerninhalte rausfiltern und dann die wichtigsten Sachen oder die für mich wichtigsten Sachen und hoffentlich auch für euch muss ich rausfiltern und in Bilder umwandeln. Also zum Beispiel hatten wir am Anfang von Cara, we have to take action upon response. sehr gut gefallen. Das Zitat, mit dem habe ich jetzt dann quasi mein Blatt hier gestartet. Ja, und dann sieht man hier den Herrn Adrian und Herrn Ryan. Und dann muss ich eben so schauen, was für wichtige Informationen kommen und muss die irgendwie gruppieren.
Also das ist jetzt aber nicht unbedingt eine chronologische Anordnung, sondern du hörst so die wichtigsten Schlagworte und verewigst die dann sozusagen da.
Genau.
An der Stelle.
Also es ist teilweise kann es chronologisch werden. Hier ist es jetzt nicht so passiert, weil ich dann zum Beispiel ja auch was reingebracht habe, was am Schluss nochmal gesagt wurde, habe ich hier an eine Stelle gebracht, die ich eher am Anfang gezeichnet habe. Also zum Beispiel, dass hier Long Time und Short Time müssen wir beachten. Da habe ich irgendwie das Männchen mit dem kleinen Fernglas und mit dem langen Fernglas gemalt. Das hat jetzt auch Herr Ryan eigentlich gesagt, aber das habe ich eben jetzt dort eben reingebracht, weil das ganz gut gepasst hat.
Ja, also auf jeden Fall richtig spannend. Nochmal auch an euch der Hinweis, dass ihr Sebastian die ganze Zeit im Livestream auch begleiten könnt bei seiner Arbeit. Und auf jeden Fall, also ich könnte das nicht so simultan zuhören und dann gleichzeitig nochmal und so. Also auf jeden Fall cool, dass du heute bei uns dabei bist.
Ja, danke.
So, und ich nehme euch jetzt nochmal hier rüber mit, denn bei uns geht es jetzt in die erste Workshop-Session-Runde. So, und es wird 3 parallele Workshops geben, die findet ihr auch im Programm und könnt dann auf den Workshop klicken, der euch am meisten interessiert. Es wird Wikimedians for Disaster Response geben, Beiträge des Wikipedia-Ökosystems zu Kommunikation bzw. Wissensvermittlung in Katastrophenkontexten, entweder auf Deutsch oder auf Englisch, je nachdem, wie das für euch gleich von den Teilnehmern am besten ist. Von der Aktion Deutschland hilft, Potentials and Challenges of Anticipatory Humanitarian Action from the Perspective of Local and International Aid Organizations, auf Englisch, wie der Titel schon verrät, und vom Fraunhofer Institute for Technological Trend Analysis, EU International Cooperation and Procedural Interoperability in Wildfire Management, auch auf Englisch. Also wie gesagt, die werden parallel in 3 verschiedenen Streams laufen. Klickt euch in den ein, den ihr am besten findet, der euch am meisten interessiert. Und wir treffen uns hier wieder pünktlich um 13 Uhr im Hauptstream, damit es weitergeht.